Today, we're exploring potential treatment options for hip issues in young adults. Our facilitator is Gary Desjardins. He has over 15 years experience as a life science product marketing executive, earning the J&J Achievement Award for excellence in leading new product commercialization. Welcome, Gary.
Good day, Gene. Good to be with you today.
So today we're on theme number 2, which is going to go back a little bit because today we're going to take a moment to meet the patient and the diagnosis and some of the therapies. Tell us about this.
Yeah, that's right. The introductory theme was more about discussing the disease state, but in the process of doing that, a lot of the panelists brought forth some really good ideas. So in this theme, we're actually presenting the more specific detail on the patient, their condition, the tests that have been run, a diagnosis that their primary care physicians or surgeons have made, and then the initial therapies that they started. And as we get through the presentation, we'll talk about how that's evolved thanks to the contributions of the panel.
Now, this is a really wonderful panel in general because this is we're talking about an actual person who has an actual medical problem that we're trying to solve with a group of panelists that were assembled via AI. So tell us a little bit about the diversity of your panel here.
Yeah, it is a very diverse panel, and that was really important, I think, for our clients, for the parents. And we have everybody here from a traditional physician here, as you see, Mark Hyatt, but you have others that are naturopaths, chiropractors, others that have very specific experience in nutrition or in other types of therapy, meaning physical therapy. So it really gave us a nice broad cross-section of different approaches that might be able to be used for our young patient.
In your theme objectives, you talk about, this is building on the previous theme, but it's going to have more patient information for us today, right?
That's correct. So the stimulus that we are providing in this theme, or have provided in this theme, then can be the catalyst for additional thinking and additional information to help the parents. And so that could manifest itself in either additional therapies that now come to mind with greater detail. They may actually reveal certain things that we may want to retract on that we don't want to consider going forward. And in the process, there might be some thoughts about the diagnostics that could be done or have been done, and whether further diagnostic evaluations might be helpful in better understanding solutions. There was a small labral tear as part of the patient's condition, and we really learned a lot more about the labral tears, and that was, or I think will be, very helpful for the parents a little farther down the road, but it was really a rich discussion on that. And then finally, the panel continues to bring forward solid science-based or evidence-based ideas. So again, not just something that's kind of cooked up, but real solid, high potential options for the parents to consider.
Oh, how wonderful for the family, right? So let's start with the patient introduction and diagnosis. We know it's a 17-year-old female.
Yeah, she's very active, primarily plays a lot of soccer, although she's also active in basketball. She was exhibiting some pain, some bilateral hip pain in the lower back. That's what prompted her parents to start to see some physicians and then later on some specialists. And in that evaluation, then through the different steps in the process, they did a wide variety of physical exams, range of motion, pain indexes, and then obviously that's complemented by x-rays, and then in this particular case, even a CT scan. So all those then came together to present a diagnosis. And of course, by now we all know that hip retroversion was the key diagnosis, but probably not earlier mentioned was the small labral tear, the tight IT bands, and a little bit of snapping hip. So those are all the things that are kind of surrounding now this condition that this young girl has.
Well, you'd think the first piece of advice is don't be active, and that might not be the best advice, but it's, that seems to be the path of least resistance from a diagnosis standpoint, right? Just quit playing soccer and basketball, right? But that's not what we're going to find out today, is it?
No. And that's a very good segue into the next slide. As they went through the diagnosis process, and they were evaluating different options, and that's what led them to here. Retroversion surgery in and of itself is very invasive. It requires, basically breaking the bones and realigning them. And as part of the diagnosis, then obviously there was also this labral tear that could be remedied through surgery. But the surgeon really didn't feel that was a good idea at this time until further work had been done in terms of trying to get the patient comfortable and possibly other ways to maybe realign the hip area to reduce the chance of having another tear. That was really the big concern here. And in the process, then the surgeon also told the patient that, playing really wasn't going to cause further damage. And the feedback from the parents has been that even when she rests, or when she plays or when she rests, there's really no difference in terms of the pain. It's more of a constant pain. So
let's get into the additional therapies, because it sounds like now these are the therapies that have been tried already. Is that right?
That's correct. So relative to the IT band and the snapping hip, they did a foam roller. They didn't really get a lot of relief on that. The rest, as I mentioned, never really helped. The pain wasn't worse when they were playing or when she was playing or when she wasn't playing. They even tried orthotics, got some custom-made orthotics, and that didn't provide any relief. The foam roller I mentioned has provided some slight relief. They've done some fairly mild anti-inflammatories, Mobic, and that's provided some relief. More recently, they've gotten involved with more of a sports physical therapist, and that has been helpful, the most helpful so far. However, as we get later on into the presentation, we'll talk about the fact that there's some things that the board's brought forward which are also complementing that in more of a combination type therapy. So we'll get to that in just a couple minutes.
So why don't we finish then with your executive summary here, because it sounds like we're ready to move in, right?
Yeah, that's right. So again, we've continued to get some high potential, minimally invasive options. We also were benefited by the robust characterization of the labral tear and the risks, rewards of surgery and approaches to do different therapies, whether it be for something that's nominally invasive, such as steroid injections or surgery. We're getting that broad spectrum of surgical risk.
Great. So let's get into your key point number one here. Lots of comments from lots of panelists, and then some new non-invasive therapies identified, right?
That's right. I mean, we started off really fast out of the gate with over 20 non-invasive therapies identified. That's what the NIT stands for. And then we've added to that. And a nice combination of different real-time, really, I think, applicable options, everything from hydrotherapy, compression, some more on nutrition with omega-3, body mechanics, dry needling, other types of injections, whether that be steroid or PRP, and then, of course, hip strengthening exercises, as you can see from the right-hand side here with Lawrence and Ryan and Mark, amongst others, contributing to this. So, again, continuing to build off the theme, and the stimulus was a little bit more detail on the patient. And so this is great.
So key point number two, the conservative approach, but keeping a watchful eye. Elaborate.
Yeah, again, this theme of being conservative, but not just being blind to new options, starting off with medications and functional therapies as kind of the baseline and starting to move from there. And so then the watchful eye comes up with indicators, leading indicators as to if these things happen, like fibrosis, or the range of motion starts to get constricted, or there's more locking, snapping, or catching, that might signal something a little bit more serious, and then to kind of revisit maybe some of the more invasive types of approaches.
Great. Let's move it into key point three then, which is continuing to evaluate the risk and reward of all the different options. I like that this is a living, breathing idea, right? They're staying in touch with her symptoms and her physicality, right?
That's right. What's great about the board is they're also painting the risks in case they have to move to something that's a little bit more invasive, that they understand what those risks are. And so they're making sure that the parents are well equipped to be sensitive to these and can have really informed discussions with surgeons or other physicians going forward. And then in the process of educating the parents, then they're giving them with real tangible surgical approaches and the science behind them. So again, they can be very informed as they have conversations going forward.
I really liked your slide 13 here, which is talking about our young athlete is getting better.
Well, yeah, all of these items here are approaches that the board has recommended: anti-inflammatory diet, Epsom salts and lavender baths and soaks, ice, steam, and heating, depending upon kind of the situation. Electrolytes and mineral drops. They're looking into the chiropractic suggestions and the pelvic tip acupuncture, and then they've been doing a lot of work in the soft tissue work and muscle strengthening exercises. That's where a lot of the short-term gains have come from. And one of the things that came up in the panel from a couple of the panel members is to be sensitive to the psychological state. And what all of these new options are doing for the patient is it's giving her hope.
Again, thanks to this great panel, and these are three that really stood out. Tell us about them.
Yeah, it's hard with such a great panel to necessarily narrow it down to three. So I want to thank everyone on the panel. These three have been more consistent, I would say, and really provided, I think, a lot of buy-in, which has really been helpful, as well as their different perspectives.
Excellent. Well, Gary, thank you for walking us through this deck. So fascinating. And of course, ending on such great news and hope as a theme is so worthwhile. So thank you very much.
Thank you, Gene.
Again, Gary Desjardins, over 15 years experience as a life science product marketing executive, earning the Johnson & Johnson Achievement Award for excellence in leading new product commercialization. And Gary, we will talk again.
Thanks, Gene. Have a great day.